DHR Health is the largest health system in South Texas. We're a full tertiary academic level 1 trauma center, the only level 1 trauma center south of San Antonio. The kind of traumas we can see here at a level 1 trauma center are anything from elderly falls, motor vehicle accidents, ATV rollovers, pediatric injuries like falls or jumping from trampolines, all the way up to stab wounds and gunshot wounds. Trauma care doesn't really start when the patient hits the door here. It starts when the emergency medical services, the pre-hospital providers like EMTs, paramedics, fire departments, police officers, when they arrive at the scene. It's a venous thrombosis or? FirstNet is important because it allows EMS providers, hospital personnel, all of that network to be connected no matter what happens.
As a paramedic, our job is taking care of that patient. We're not the definitive care. We need to communicate with the hospital. We need to communicate with somebody above us to decide what we need to do. Essentially now we can submit everything that we're doing on scene to the hospital, whether it's our cardiac monitor, whether it's our ventilator, everything that we do is transmitted. Certain systems even have a process where you can actually monitor the whole ambulance while you're inside the ER.
Many times, EMS chiefs will call me right from the scene. Hey, we got this bad car wreck. Patient looks like they have a broken leg. They can't breathe. They're going to need to be intubated. Never dropping a call or losing that communication with the pre-hospital provider and having the reliability of that is going to impact the patient care. Getting pictures or video from the scene is very helpful because as a trauma surgeon, I'm always trying to evaluate how much energy was delivered to a patient in this event. For instance, this severe head-on collision that we received this morning, she rear-ended somebody, did enough to completely crumple the front of her car. That can create what's called a deceleration injury. It's when a human body is moving at a speed and comes to a sudden stop. It can actually cause certain organs internally to have damage, and it's important to know that.
The sooner that we know about the patient, we're able to better prepare and get all the staff at the bedside. Sometimes you need to activate the OR team or maybe activate the ICU because they're going to get multiple patients coming from the ER. You need to have good communication to be able to bring those people in to be able to deliver the care that needs to be given to the community. So our goal is to have everybody at the bedside before the patient gets to us.
The breadth of communication that we need to be able to deliver has definitely increased. Being the level 1 trauma center, there's a lot of big decisions that need to be made. Sometimes they require being able to know that those folks are going to be able to communicate with me no matter what time of day it is, where I am. We have a lot of people that are relying on that connection. FirstNet has allowed me to stay in communication with people that need to get a hold of me, whether it's people in emergency situations here in the hospital, my family, whatever. So I think that gives me a certain sense of security.